my YouTube channel. On today's video, I will be talking about how you can secure your bag before you graduate nursing school and nursing interview tips that you should know. So if you're interested, please stay tuned. So if you do not know, there are many facilities that allows nursing students at the end of the program. So this will be at the beginning of their last semester or the beginning of their last year. Facilities allow them to start applying for nurse residency programs. If you don't know about a nurse residency program, it is basically a program for new grad nurses that allows them to start on a floor or unit of their desire, and it gives them more classes, more orientation, or a longer orientation than a regular nurse. And with these programs, they're usually for 2 years. The residency program is for a year, and then they're contracted for another year to stay at the facility. So it's usually a 2-year contract that is included with the nurse residency program for the new grad nurses. So many hospitals now allow nursing students to apply for these nurse residency programs, and usually is about 4 to 6 months prior to the anticipated graduation date. And with this, the nurse students are able to apply to as many facilities, many units as they want, depending on the hospital policy, and they will be able to be interviewed with those said units. So with nursing interview tips, some things that you should know is to always be prepared. Make sure that you are looking up these facilities. Make sure that you know something about the facility. If they are known for their emergency room, they are known for their stroke unit, they're known for their OR, if they're known to be #1 for mother baby. Make sure that you know some basic information about this facility, know their mission, know their purpose, and know what they do in the community, because you will be asked in the interview, why are you choosing to work here at this facility rather than working somewhere else? Also, make sure that you know some basic information or have some experience in the unit that you are working in, because you will be working in this unit for a year or 2 or longer, and the managers, the supervisors would like to know if you have some experience, if you're able to bring something, contribute to the unit. And this will be beneficial for everyone, not only for yourself to have a new job in the unit, but it will also be beneficial for the nurses as well as the managers, the nursing director. It would just be a contribution as a whole. Also, make sure that you know some information about the unit as well, because you will be working with these patients, and the managers, the supervisors, the charge nurses would like to know if you have any experience, so that when you get on the floor, you will know what to expect. You won't just be going into the unit not knowing anything at all. The second thing is to know your strengths and weaknesses, because you will be asked your strengths and your weaknesses, what they are, and how can you improve, or how can your strength be beneficial to the unit, how your weakness can be improved to help take care of your patient and make you a more competent nurse. So make sure that whenever you are applying for a position and you get an interview, make sure that you are writing down your strengths and weaknesses and put them on a little note card just in case you forget. And be real, be true about your strengths and weaknesses, and make sure that you are elaborating on why this is your weakness and how you can improve and how this can help you become a better nurse. And the third thing is to make sure that you are doing this for yourself. You are applying for this nursing position to take care of the patients, and it's not always about money, because yes, nurses get paid a good amount of money depending on the experience. But no, nursing is not all about money. Make sure you're going in this for yourself, because if you go into a nurse residency program, or say that you have been working as a nurse previously and you're going into work at a different facility, you will be working on this floor, and if you don't like it and it's not your passionate unit or department, you will be miserable. It will show to your patients that you don't want to be at work and that you hate it there, and it will make them feel as if they've done something wrong. It will show towards your managers, and this will bring light on how you will be evaluated. It will just show to everyone that you don't like it there. You're not interested in working there. You want to leave. And with this, it brings very, very bad tension, because in nursing, networking is always important. And if you're trying to go to another unit at the same facility, I'm sure your manager will talk to that manager about how bad of an impact you are on that unit because you are miserable. So make sure that you're going into nursing or going into that unit that you are interviewing for because you really want to work there. That's your passion. That's where you want to grow. That's where this will help you benefit. It will help benefit towards your future goals. Don't do it because you think, well, this is the ICU. I've heard ICU makes more than med-surg, so I'm going to go to ICU instead of going to med-surg. Do not do it. So my 3 tips are to always be prepared, to know your strengths and weaknesses, and to do this for you and be true to yourself. Also, whenever you're going into an interview, make sure that you're professional. If you have to, make sure that you are prepared physically, that you buy a suit if you have to invest in a suit. They usually like black, navy blue, or dark gray suits, black or dark brown shoes, and belt. Make sure if you're a woman, minimal makeup, hair pushed back in a ponytail. No flashy jewelry, no colored makeup, minimal makeup, a little bit of lip gloss. Go in because your personality should stand out more than your physical appearance. And with you being on a panel interview or even a one-on-one interview, it will definitely show. If you are more passionate about it, your personality will stand out, and it will show that, hey, I really want to work here because this and that and that, or not because you come in looking dressy. Well, I look good, so you should hire me because I look good. So those are the 3 tips that I have for you today. Thank you all for tuning into my channel. If you're not already, please subscribe down below, turn on your notification bell, and leave some comments or suggestions. You can email them to me, direct message on Instagram, or just comment them down below of some suggestions of videos that you all would like to see. And I will see you in my next video. Thank you. Bye.